Good afternoon, everybody. My name's Erin Fatt and I'm the Programs Manager at AMSANT.
And I'm the Workforce Policy Officer and Aboriginal Health Practitioner.
So first and foremost, we'd like to acknowledge the traditional custodians on the land that we meet today, and thank you all for being here. So my role at AMSANT is the Programs Manager, and in my team, we have the Workforce and Aboriginal Leadership Support Unit. The WALS unit is made up of a number of single-funded positions that have workforce and leadership aspects. The aim of the unit is to build capacity to address workforce and leadership needs to better support our members. The team consists of Sharon, who's our Workforce Policy Officer, our two Indigenous Health Project Officers, Rebecca Wanganeen and Joe Schwartzman, our GP Registrar, Education and Training Officer, Leanne Penner, and our Leadership Program Officer, Patrick Johnson, who I might mention has done a really fantastic job the last couple of days with the leadership workshop here in Alice Springs. The main objectives for the WALS unit are to increase the number of Aboriginal and Torres Strait Islander health people working across all health professions, is to improve the clarity of roles, regulations and recognition of ACCHO as a key component of the health workforce and improve vocational education training sector support for ACCHO. While the workforce is a very diverse and very complex area, because of the limited resources that we have in AMSANT, we try to identify the needs and the areas that our sector really needs support with, and the health practitioners have been one of those. We need to address the role and development needs for other health workforce groups contributing to Aboriginal and Torres Strait Islander health, including the CAAMA ICP workers, the outreach, healthy lifestyle and tobacco action workers. We want to improve the effectiveness of training, recruitment and retention measures that target both non-Indigenous and Aboriginal health staff working in the primary healthcare sector. We want to represent the issues and interests of AMSANT members at relevant meetings and forums in relation to workforce issues, particularly with regard to Aboriginal workforce. And our final objective, to strengthen health leadership amongst young Indigenous staff of member services.
So AMSANT's had quite a few priorities. One of those that's continued to be a focus is the Aboriginal health practitioner profession. As we've all heard already this morning from Minister Lamley, it is a profession that's struggling. There's declining numbers, limited numbers of graduates. It's an ageing profession, and there's very few young people entering the profession. So these sort of priorities has led to AMSANT having a strong focus on supporting this workforce, where we held the Year of the Aboriginal Health Worker in 2011-2012, and also just last week at the Natsiwa conference, AMSANT won Health Service Legend, won an award for that, which is really good, and some people know Peter Panqui. He also won an award as Senior Aboriginal Health Worker Practitioner. So congratulations to him. Oh, sorry, wrong way. So as I mentioned, the numbers are declining. We do hope though, as you know, in 2012, registration for Aboriginal health workers went national. That's when our title changed to now be called Aboriginal Health Practitioners, or ACCHO practitioners. In 1999, there were 431 registered Aboriginal health workers in the Northern Territory. Today, there's 223, so you can see that the numbers have dropped a bit. There's 330 nationally, and it is predominantly a female workforce, although I have had the opportunity to go and speak to students at Bachelor Institute recently and at other training providers around the Northern Territory through my role on the APRA Accreditation Committee. I've been able to see that the classes do have 50-50 male and female students, which is really positive. In 2009 there was an Aboriginal health worker professional review done by Lee Ridout, some people know him. From that review, AMSANT got a project officer. There were 23 recommendations that came out of that review. There were things such as housing support, training reform, career structure and qualifications, clarifying the role, cultural security, and marketing the profession, amongst others. There was 23 good recommendations that came directly from Aboriginal health workers and their employers. There were three agreed priorities out of that review, that a committee made up of executive members from community controlled and Department of Health who agreed on those three priorities were training and education, cultural security and role clarification. There they are, sorry. So with training and education, AMSANT's been very busy working towards trying to improve in this area. We did put in a submission for Aboriginal health worker educators to be based within our health services, similar to some people know Congress have training within their centre, and Wollongong have a model that seems to be very successful. That submission was unsuccessful, but doesn't mean we won't continue to try. There's also been literacy and numeracy support through the WELL training and working in partnership with Haystack. That was really going really well and was very successful, but that also lost its funding this year, which was a big shame. You will hear from Wendy soon about Back on Track, so we're working in partnership, and we have our CEO, Pato, and Donna and Marion on the task force there, which you heard a bit about from Minister Lamley this morning. And we've been doing work within the Walls unit and within my role as policy officer on professional development for Aboriginal health practitioners, working with various training providers. An email just for our members. An email's been sent out recently from John Patterson seeking anyone who may be interested in participating in a pilot project with Ganarton for Aboriginal health practitioners to put your portfolios together, professional development portfolios. So if you are interested, I'll be travel to your health service to deliver one-day training. There's been management support. We work closely with the Heart Foundation on their various resources, updating them. We also have participated in the Workforce Working Group within the Aboriginal Health Forum, and you'll also hear from Raylene from CARDS very soon. We had a very good meeting last week at Natsuwa about how we can introduce the certificate to ACCHO primary healthcare into our vet in schools within the Northern Territory to encourage our young high school leavers into the health profession.
And one of the great examples of the management support and training is our project with BCA National through the Workforce Working Group. We have 19 out of 22 individuals right across from our sector who are scheduled to graduate with their Diploma of Management in November. So that's a really good outcome, and we're pretty excited to see those guys graduate in November.
One of the other priorities was cultural security. That was for Aboriginal health practitioners in the workplace and clients of health services. We have a position, Leanne, who's here somewhere, that works between AMSANT and NTGPE on cultural orientation for GP registrars. That, I reckon, is the best orientation that I've seen in the Northern Territory. We're also working closely with Medicare Local at the moment with their cultural awareness training for GPs. They recruit a lot of international GPs, so we're trying to help them improve that process. Also, NT Flinders Medical Program. My role as Policy Officer is a part of the ACCHO Advisory Committee, which the lovely ladies will mention soon, and the Bachelor of Health Science Advisory Committee. So you can see my role in AMSANT and our work, the process or the role we play in workforce support is very much an advocacy role. And I've also been able to start, and some people here will receive emails from me, Aboriginal health practitioners. I've got an email distribution list. In regards to the third priority area, the role clarification, I've been lucky enough to also, NATSIWA, you would have seen they've got a stall out there, undertaking the Scope of Practice project, which did begin with Health Workforce Australia. They were involved in it, but NATSIWA are taking control of that. So I'm on that committee representing the Northern Territory. You can see those other people there, and Jenny Polina's involved as well. And there's a very senior Aboriginal health practitioner, Karen West from Queensland, who's been a health worker over 45 years, who's also on that, which is great. Oh, sorry, a bit slow. So that's the people there that are on that committee, and that should be 3 members from state jurisdictions, and it's actually 4 members from the non-government sector.
So our focus from now and into the future, you would have heard earlier today about the changes with the federal government, and the workforce area has been one that has been hit quite hard. We've lost a fair bit of workforce and education training funded initiatives, which includes the workforce policy position within AMSANT, but we see the priority of maintaining such a position. We've also lost a lot of national networks such as like ACCHO, Health Workforce Australia being absorbed back into the Department of Health. These sort of moves actually create a lot more angst and more barriers and challenges in trying to move the way forward with what's already a challenging situation to deal with workforce. But one of the good things that has come out of all of this is that we are looking at reviewing how we do our workforce focus within AMSANT, looking at becoming more regionally based within the NT. There has been a lot of time and energy focused on a national policy setting, but now what we're doing is drawing on that work that we've done at the national setting to be able to bring that into making it into more of a member support focused area. Our AMSANT leadership workshop that I mentioned before, that has been running over the last 2 days, we have a number of people working on that or participating in that are health practitioners, admin officers from a range number of areas, all coming together to talk leadership and building those skills based. Improving communication, education, training and career pathways for Aboriginal workforce. Again, all of the things that we've talked about, that's one of the core outcomes that we want to keep working towards. Data collection to analyse workforce needs. It's always been a biggest barrier for us in trying to ascertain and maintain those sort of databases, but we're very determined to make that a priority and to get that happening. Potential further workforce support and communication for and with Aboriginal staff, and again that's looking at incorporating a number of health professionals where you have Aboriginal staff working and bringing them all together to work together.
Thank you. Thank you.